Welcome to our new video Nursing MCQ 2024 with explanations. What is the primary action of an inotropic medication? Decrease heart rate, lower blood pressure, increase the force of heart contractions, reduce fluid retention. The correct answer is option C, increase the force of heart contractions. Explanation: inotropic medications helps the heart pump blood more strongly. They increase the pumping power of the heart, which can be especially useful for patients whose hearts are weak or struggling to pump blood effectively. By strengthening the heart's contraction, this medication helps the heart move blood around the body better. A patient reports experiencing chest pain during physical activity, which goes away within a few minutes of resting. This is an example of unstable angina, stable angina, myocardial infarction, none of these. The correct answer is option B, stable angina. Explanation: this situation describes stable angina. When the patient does physical activity, their heart needs more oxygen. If the heart can't get enough oxygen, it causes chest pain called angina. In stable angina, this pain is predictable and usually goes away after a few minutes of rest. Cells which continuously multiply and divide throughout life are called permanent cells, stable cells, labile cells, stem cells. The correct answer is option C, labile cells. Explanation: labile cells are types of cells in the body that keep dividing and renewing all the time. They replace old or damaged cells to keep tissues healthy. For example, skin cells and cells lining the stomach are labile cells because they are always renewing themselves. What is the most common initial symptom of a subdural hematoma? Severe headache, dizziness, gradual onset of confusion, nausea and vomiting. The correct answer is option C, gradual onset of confusion. Explanation: a subdural hematoma happens when blood collects between the brain and its outer covering, often due to a head injury. The pressure from the blood buildup can cause symptoms. The first sign is often confusion, which may start slowly and get worse over time. This is more common in older adults because their brains are more sensitive to pressure from even a small amount of blood. Which of the following is a non-drug therapy for children with epileptic seizures? Cognitive behavioral therapy, ketogenic diet, low-fat diet, high-protein diet. The correct answer is option B, ketogenic diet. Explanation: the ketogenic diet is a special eating plan that includes lots of fat, very few carbohydrates, and enough protein. It changes how the body uses energy and helps reduce seizures in some children with epilepsy. It's not a medicine, but a way of managing epilepsy through food. How many days is a full-term pregnancy? 240, 260, 280, 300. The correct answer is option C, 280 days. Explanation: a full-term pregnancy lasts about 280 days, which is roughly 9 months. This time is counted from the first days of the woman's last period, not from the date of conception. So when doctor says a pregnancy is full-term, it means the baby has had enough time to fully develop and is ready to be born. Insufficient oxygen supply to the myocardium, the heart muscle, leads to angina pectoris, chest pain, myocardial infarction, heart attack, arrhythmias, irregular heartbeat, heart failure. The correct answer is option A, angina pectoris, chest pain. Explanation: when the heart muscle doesn't get enough oxygen, a condition called ischemia, it can cause chest pain or discomfort called angina pectoris. If the oxygen supply is completely blocked for a long time, it can lead to a myocardial infarction, heart attack. ART is used in the treatment of tuberculosis, HIV/AIDS, diabetes, hypertension. The correct answer is option B, HIV/AIDS. Explanation: ART or antiretroviral therapy is a type of treatment used for people with HIV. It works by reducing the amount of the virus in the body, which helps keep the immune system strong. This treatment doesn't cure HIV, but it allows people to live longer, healthier lives and reduces the chance of spreading the virus to others. The removal of the full breast is called lumpectomy, mastectomy, biopsy, mammoplasty. The correct answer is option B, mastectomy. Explanation: a mastectomy is a surgery where the entire breast is removed. It is usually done to treat or prevent breast cancer. This helps remove cancerous tissue or lower the risk of cancer in high-risk individuals. Which position should be provided to a patient after recovering from anesthesia? Supine position, lateral or side-lying position, front position, high Fowler's position. The correct answer is option B, lateral or side-lying position. Explanation: after anesthesia, patients are typically placed in the lateral or recovery position. This helps keep the airway clear, prevents choking on secretions or vomit, and reduces the risk of aspiration. Oral dysesthesia means difficulty in swallowing, loss of taste, burning feeling in mouth, dryness of the mouth. The correct answer is option C, burning feeling in mouth. Explanation: oral dysesthesia is when your mouth feels like it's burning, tingling or sore, but there's no clear cause like an injury or infection. This feeling can be annoying or painful and can make eating or talking less comfortable. Prothrombin is also known as factor 8, factor 9, factor 10, factor 2. The correct answer is option D, factor 2. Explanation: prothrombin is a protein in your blood that helps it to clot when you have an injury. It's also called factor 2 because it's the second clotting factor in the series of steps that your body uses to stop bleeding. Without enough prothrombin, your blood won't clot properly and you could bleed too much. Stomatitis is the medical term for a sore and inflamed stomach, throat, mouth, intestine. The correct answer is option C, mouth. Explanation: stomatitis is when the inside of your mouth becomes sore, red and swollen. This can happen on your gums, tongue, cheeks or lips, making it uncomfortable to eat or talk. A patient has difficulty in swallowing medication and foods. The nurse will document that this patient has dysphagia, dyspepsia, dyspnea. The correct answer is option A, dysphagia. Explanation: if a patient has trouble swallowing food or medicine, it's called dysphagia. This means they might have difficulty getting things down their throat, which can make eating or drinking harder. Thanks for watching. Subscribe MCQs 1 for latest informative MCQs.